Hello. Thank you very much. Sarah and I are very excited that we have the opportunity to come and share our perspective, our youth perspective. So we're going to try and keep y'all awake. I know you just had lunch and that can be difficult, but figured it'd be good for us to kind of tell you a little bit about ourselves and why we are here speaking about this topic. So I was born in a very small town in Mississippi and had health problems since birth. So when I was born at the hospital, the doctor said some things just don't seem typical, but they weren't sure what these not typical things were. So they said, it might be a good idea for you, meaning my family, to travel around for a little while and see, okay, what's this thing that's not typical? So my parents packed everything up and packed my older brother up, and we hit the road and we started traveling around. We traveled around all over the U.S. to try and find care and received several diagnoses along the way. By the time I was 2 years old, I was diagnosed with juvenile rheumatoid arthritis, and that was really kind of when the big part of my journey began. I had my first surgery at 10 months old, and when I was 7, we ended up in Colorado. So we had gone from Mississippi to Kansas City to Boston to New Orleans to Jackson, and somewhere along the way we were sent to Denver, Colorado to see a specialist. And that's kind of where my care stayed for a long time, was in Colorado. And from there, in 2005, Hurricane Katrina hit. So for our little town in Mississippi, wiped everything out basically, even the closest airport. So we were no longer able to travel to Colorado, which was a big problem. So we actually up and moved to Nashville because we heard all about the various resources, the various children's hospitals, all in Middle Tennessee. And so that's what my family did, is we packed up and moved to Nashville. So by the time I was 12, was diagnosed with Crohn's and had had about 45 surgeries by this time. And we continued to go back and forth from Tennessee to Colorado because my specialists were there. I was able to get some care here, but for the majority of things, my specialists were still in Colorado. So when I was 16, I graduated from high school, and that was a new challenge. Now I had to figure out how I was going to get care from Colorado to Nashville to a little place called Henderson, Tennessee, where I went to college. I spent 3 years there in college and graduated at 19 and was diagnosed with myasthenia gravis last year when I was 20. So it just seemed like there was a big storm of stuff happening. I've had 78 surgeries, and I'm going to celebrate 79 in a couple of weeks, so that's exciting. But so I've made several transitions. I've transitioned from all over the country to Colorado, from Colorado to Nashville, and doing care in between, and then from college. But by far for me the most difficult and I don't want to say looming transition, but very intimidating transition was the transition from pediatric to adult care, which is what we're going to talk to you a little bit about today. But I know Sarah wanted to tell you a little bit about herself too, so.
Thanks, Anna. My name is Sarah Sampson, and I was born in New Jersey in 1989. And I remember going into the big city, downtown Manhattan, to see doctors, to see my dad at work. And so we lived there through elementary school and then moved to just outside of Chicago, Aurora, Illinois. And luckily not to receive care, but because of choice, my family wanted to move there to be closer to their family. I feel like I started my transition in about high school when I had to have what my family refers to as my second big surgery. I went to Mayo Clinic when I was 16 to have my second open heart surgery. I was born with an atrial septal defect, so a hole in my heart, and malformation of the mitral valve. So my journey, I think I didn't realize until after that second surgery how, as a kid, I just didn't have as much energy as everybody else. And since I have really taken on more responsibility for my own medical decisions and come into my adult healthcare decision making, I really feel like at that pivotal age of 16, it all began. In part because my mom sort of helped give me some of the choices and responsibilities, and in part because it's a part of the growing up process. You transition to independence as well as to your adult medical providers. So I came to Nashville in 2007 in order to go to Vanderbilt for undergrad, and I came here without a plan. I guess I thought I would just see my specialists and PCP, primary care physician, when I went home on breaks, which mostly worked until I had an emergency and realized how if I would have had a plan in place and knew where to go, it wouldn't have been so scary. So that's something we'll be talking about today, how early planning will really pay off. And so there have been good parts and some bad parts to my transition. At 25, I feel like I am now the driving force behind my medical decisions in healthcare. And I went through a lot of research to try and understand which were the best doctors for me here in Nashville after finally officially transitioning from pediatricians to adult care. And feel like in that process, I have become a self-advocate, and that's helped me in my job now teach others to self-advocate. Man, you gotta know what questions you're gonna ask when you go into the doctor, because it is very different as an adult versus as a child. I feel like as a child, my physicians were helping to lead me towards my future care, and as an adult, I am rushed through and better know what I want to accomplish so I can help my physician get there with me. So that will lead us to
our next topic. So how I transitioned, it was a little bit different. I know there's a lot of ways to transition, and I don't know necessarily that there's the perfect way to transition. But for me, because I had so many specialists involved, I had an average of 9 specialists at any given time. So sometimes there were more, sometimes there were less, but on average, I had about 9 to deal with on a regular basis. So transitioning, we knew was going to take a lot. So you have your primary care, and then you have all of these specialties, and each one I'm going to have to transition eventually. So for me, the discussion of transition really didn't happen early on. Something that I wished we had had more time and more preparation for, but especially when I was transitioning, it wasn't really a hot topic at that time. So I remember the discussions beginning around when I was 15, 16, so I was a senior in high school, and that's the transition discussion kind of started on, okay, so what are you going to do when you go to college? You're going to be 3 hours away from the closest care that you have established. What is that going to look like? So that's kind of the first step is I really wish someone had said early on that we could have been thinking and planning for this, but really the initial discussion started at somewhere between 15 and 16. And for me, I saw specialists a couple times a week, so I was constantly at the doctor. And because I was seeing my specialist so often, I didn't see my primary care that often. I would go if I needed a well child checkup or if I needed something specialty, if I got strep throat, something like that. But on a regular basis, I was seen primarily by my specialists. So it was a little bit different because then when I turned 18 and started realizing, oh no, I can't stay in the colorful children's hospital forever, that I was going to have to make some kind of move. And I really, really wish that it had gone a little bit smoother, especially early on. I had a rough start to my transition because I was seeing my specialists so often. My specialists were the first ones I talked to of, okay, can we find me an adult primary care? I figured that would be a good place to start instead of trying to change all these specialists that have been with me for years and years. Let's just start with the pediatrician. Let's do one thing at a time. And I had one of my doctors look at me, and he was a specialist, and he said, I will not make a referral for you. And I said, what? Like, that's what you do. You make referrals. You're the doctor. And he said, I'm not going to be responsible for putting you on somebody else. And I was crushed. Like, I left that office visit in tears. My mom was just, like, on fire. She was ready to go at somebody. But I was just crushed. I mean, it's so disheartening. And so after that, what do you feel like? You feel like a burden. So I didn't mention it to any of my other doctors because I didn't want to hear that again, and I didn't want to be looked at as a burden. So I said, okay, I got this. I can do this. And so I started looking for my own providers. which you can only get so far doing that. But I really felt like I was on my own and had to do this on my own because I didn't want to feel like a burden and I didn't want to put somebody out. And as soon as that physician said that one sentence to me, I was like, I'm done. I don't want to be put on somebody. I don't want somebody to feel like that. I don't want someone to have to deal with me and have to deal with all my problems and all my issues. And so I kind of took matters into my own hands and tried to find physicians my own, and it wasn't super successful, if we're going to be honest. It's not, I feel like when you have this much involved, it's not something you can do by yourself. Or even, I mean, my parents were very involved, but there was only so much they could do because this is beginning to get into the adult world, and they can't just call and make appointments for you and say, this is what my daughter needs. And so I remember there was a period of time, and with arthritis, you're on immune suppressants constantly, and so my immune system was terrible. And I was sick constantly, and I finally went back to my primary care doctor in hopes that he could help with that. But while I was there, I said, you'll never believe what happened. And I loved my pediatrician. He was phenomenal. But he said, I can't believe he said that to you. And I said, I can't either.
This term of the medical home term, I don't think had really popularized yet. Been out of school for 5 years, and maybe even it still needs to trickle up from pediatrics to adult care. I feel like I have to ask my specialist, can you please consult with my PCP on this? Or I don't really want to start taking this drug right now because this is what else is going on. So that's a cool feature of your PCP now, and something I would really encourage others to take up, because while the quarterback can sound like a big job, even if my PCP would just make the phone call, or have her receptionist or nurse make the phone call to the other specialist to consult, that's it. That's all that would make a huge difference to me being the recipient of care. So. Can you tell us, Hannah, a little bit more about the role of your parents and your husband in your healthcare? Because I know we wanted to talk about the role of family in the transition.
Yes. So for me, my family, we are like one big happy family. We're very involved in each other's lives. Extremely so. So growing up, my mom and I were often the ones that would travel to Colorado, and my dad and my brother stayed back in Nashville a lot of times. Now, my brother had some special health care needs as well, so he would travel back and forth as needed, but a lot of the time we were separated. And my mom, growing up as a kid, I remember her kind of being that sole advocate. Like, she's right there in the front line, and she's ready to help me and ready to make sure that I'm receiving the care I needed. Now, when we moved to Nashville and I went to college, I started kind of taking over that role a little bit. However, my problems have been going on since birth, so there's still a large memory gap of history that I don't really remember. I mean, I remember what my mom tells me about it, what happened during that time, what medicines I was on, but as a whole, I really don't truly remember when I was 6 months old and 10 months old and 2 years old and all of that stuff. So, the thing, and I know we'll talk a little bit about the culture shock of transition when you're youth as well, but one thing that's definitely been part of that culture shock is how in the adult world, family's not incorporated as much. So I know for me, I'm also married, and I'm married young, I realize that, but a lot of doctors kind of have a problem with that. And they're very vocal about it too, which is a little surprising. But they're also vocal of the fact that they don't always want my parents involved. And I understand I'm 21 years old and I'm here to advocate for myself, but there's a lot of history that I wasn't aware of and I don't know about. So when you're asking me about the history of when I was diagnosed and what medicines I was on, I can't answer that. So do you want them or do you not? And I think for me that's hard, because I want someone to ask me, what role do you want your family to have? I don't want the physicians and the providers deciding what role my family should have. I want to be the one to decide that. While, yes, I am the advocate for myself, and I'm the one taking charge, and I'm the one in the driver's seat, I see nothing wrong with the fact that my mom can't come sit in on a first visit with a new doctor to fill in some of these gaps. So I think that's definitely been a change for me, as well as the fact that I'm married throws a lot of doctors off at 21. I had one doctor who, and I promise I don't only have horrible experiences with doctors, but I went into a new visit with my husband, who was then my fiance at the time, and he was a specialist, and he looked at my husband and said, "You don't need to marry her. She's going to cost you too much money." And I sat there and I went, "What?" That was another one that my mom left ready to go as somebody. But he looked at, it was my fiance at the time, and he said that the medical bills were going to be too expensive. He couldn't afford all the co-pays. The insurance would be too much, that we should just move in together and let my parents pay all the bills. And so, yes, I realize I'm young to get married, but that's my choice. And while I see the hurdles that have been placed and you don't know how long you have, I said, okay, I've met this wonderful man and I'm going to get married. And there hasn't been as much respect around that and around my family unit. So I don't know how that's been for you, but that's a little bit about what I've experienced with the family dynamic that's very different from the pediatric world to the adult world. I remember when I had told my pediatrician, we just made small talk. I'm getting my wellness checkup of the year, whatever, and I said, I'm getting married. And he said, "You're what?" And I said, "I'm getting married." And he thought that was crazy, but he also knew Hannah graduated college at 16, and Hannah did everything early because she wasn't sure how much time overall she was going to have. And he understood that, and he got that. And maybe he supported it, maybe he didn't, but to my face, he definitely supported it. So thinking back, it's been a challenge with pediatrics and adults, and where does the family fit in? So it's definitely been a challenge.
Thanks. So for me, I mentioned how at 16 I started to join my mom in decision making about my health care, but she didn't move down to Nashville with me. So when I started my adult life here as an independent, my transition really went hand in hand with me learning to be an adult and get around a new city. And oh my gosh, I was a half an hour late to a doctor's appointment I had left an hour early for because I couldn't find it once. And that sounds like a silly young adult problem. But again, it goes hand in hand with me, with my transition to being my quarterback of my healthcare team. That involved, being my own transportation and understanding my own medical forms. And boy, did those make me sweat. The first time that I sat down in one of my current doctor's waiting rooms and tried to answer this 15-page long questionnaire, I was like, oh my gosh, I don't know. I need to talk to somebody about this. And I went up to the front window and asked questions of the intake person, and she thought I don't think she understood what I needed. So I just did the best I could and figured that I would leave it, explain things to the doctor in the examination room, which I did. It worked out fine. But again, my transition to being my own quarterback went hand in hand with me being an independent adult here on my own in Nashville. So that's my story. As to the culture shock, that sort of speaks to my culture shock too, of just things being less accommodating in the adult world than in pediatrics. I feel like I remember, specialists coming out of his office to greet me and ask how I was and think about my life as a whole, ask how school is going and what my plans were, and like you were talking about with your pediatrician. And now when I get to, my adult doctor appointments, it's like you're in, you're out, and we care about you, but they're not thinking bigger picture. And so that's something that I really appreciated and noticed the difference.
Yeah, I've noticed, I remember the first time I got sick after I turned 18, and I ran a 104-degree fever, and my husband and I said, okay, we got to go to the hospital. And so, of course, we had just been married a few months, and so what does he do? He calls my mom, and he says, we got to go to the hospital. And so Mom comes over, and I'm sitting in the back seat, and they're in the front seat, and I said, wait, you're taking me to the children's hospital, right? And she said, no, we can't. You've got to start going to the adult hospital. And I remember right then, I was like, I don't want to go. And it's horrible to say that, but I think it's a reality for a lot of us that have grown up in the pediatric hospital. It becomes a place of comfort almost. You feel comfortable there, and you're going to see all these faces that you recognize, and they're friendly. But when you walk into the adult hospital, it's very stale. It's very white and sanitary, and there's no pictures on the walls. There's no cute drawings that kids have done. It's bland. It's pretty bland. But you also notice the people there, you don't see as many people smiling. At the children's hospital, we realize there's good things that happen and there's rough days, but people are still smiling. And at the adult hospital, I think a lot of people are really grumpy. And I hate that, because you want even the person that's taking your insurance card at your visit to smile at you. You want the person who's sitting behind the check-in desk to smile at you. You want the nurse to act like she's enjoying her day. And because when I feel very unsettled, or when I'm going in for a procedure that I know is going to be uncomfortable, I at least want the person who's in the room with me to look happy about it somewhat. It's comforting. And I've also noticed that, and I'm sure you can speak to this too, is that they seem less emotionally involved. Like, it seems very detached. And I know with physicians and providers and nurses and social workers, there are very clear boundaries of how involved you need to be with an individual patient. But one thing that I very much appreciate about the care I received as a kid is that I felt comfortable with everyone who saw me in a medical environment. I felt very comfortable, and I also felt like they cared about Hannah the person, not Hannah's diagnosis. And I had a doctor who, on bad days, when I would just come in and say, I'm sick and tired of being sick and tired. That was my favorite phrase as a kid. And she would either give me a pep talk on, okay, well, we got to get over this because you're sick and tired, and you might be sick and tired for a little bit longer. But I'd also have doctors who would rejoice over, my white blood count is finally up and I can go out in public and not get sick. And here it feels very detached. Like there's a fine line of, here are your results and how are you doing today? But I don't really feel like they hear the answer of, this is how I am today. So the fact that there's an emotional disconnect that I've noticed as well. And I know when I was a kid, it's very dream-oriented. And as a kid, I was a big dreamer. And they ask you, what do you want to be when you grow up? How do you want to get there? What do you want to do when you go to college? How do you plan on getting that degree? How long is it going to take you? And still, I'm an adult, but I have lots of dreams. I have lots of these ideas that I like to follow, and a lot of things that I like to do that may seem unreasonable, might be unreasonable, but it doesn't mean I don't have them. And I think in the adult world, it's very much focused on your life revolves around your care. And that's a new concept, because I know in the pediatric world, they do whatever they can to make sure that your life goes on and that I can get back out and I can do what I want to do. And even if I can't play on the sports team, that they'll get me out of the hospital enough so I can sit on the sidelines and watch my brother play. I'm someone who likes to go and do, and I don't feel like I've had the tools medically to be able to go and do. Which is something that's been very different for me, along with the fact, and we're going to talk about this later on, but the resources. When you go to a pediatric hospital, there's all these resources. Some even have a resource center for different camps and different groups and teen groups and discussion groups and support groups and sports teams and all these things that you can be yourself with your healthcare needs, but that you can be a part of. And in the adult world, there's really not a lot of discussion about that. So, so that's some things that I've noticed, at least, about. And I can definitely say I was shocked by the culture of the adult world. But it's a very different environment. And I think, I'm not saying that the adult world should be rainbows and all of this stuff, but I wish there could be a little bit of a bridge the gap between happy, everything is going to be okay, we're gonna be right there for you every step of the way, and here's where you're at. At times, just like Sarah mentioned, you have it feels like you have 5 to 10 minutes for a visit, and it's like, I've got to get all my stuff written down, I'm ready whenever they come in. And at times you just feel like another chart across their desk. You don't feel like a patient who's sitting there telling you, this is what's going on with me, these are my daily struggles, but you just feel like a chart that's sitting there that they'll come in and address when they have time, and you get about 10 minutes to do so. So yeah, that's some things that I've noticed.
I wouldn't mind if there were a couple more rainbows and puppy pictures in some of my doctor's offices. I really wouldn't. But I think that what Hannah is talking about, I absolutely have experienced a lot of the same feelings about switching to my adult care providers. And I understand, we both understand here, that the system is different, right? I mean, I surprise my doctors because I not only see them more often than some of their other patients, but I want to build that relationship with them, and I don't feel like other patients do. And I surprise them because I'm happy to be there. I'm happy, I chose these doctors, right? Because they match my needs and because they match my approach, and I'm happy to be there to receive my care. So I think that so there's patient responsibility to getting what you want out of the experience too. We realize that. To speak to some specific points that Hannah made, the resources, I remember asking my specialist for, do you have a brochure on that? It was a very specific decision that we were talking about, and I didn't know a thing about it. And she just sat there for a second. She was like, no, actually, I don't think we have anything on this. We can Google it together if you want. And that's not something that you hear in the pediatric world. There are resource libraries available. So that is a big change. And again, I realize that I'm not in the majority who wants to read more pamphlets about their health care. But when you have the special health care needs, when you are your own quarterback, you really do have to understand more about your decisions and your care, which I think if my PCP, if the medical home was a bigger deal, was more widely adopted, I think some of that pressure would be taken off my shoulders, just to throw that one out there. Another piece that Hannah mentioned is the access. She felt like she had really good access to her pediatrician. To some of my favorite doctors, I've called them the day after Christmas because I was having an emergency and I wasn't sure how to manage it, and that was totally welcome from them. And again, I know that's not the typical, and I don't want my pediatricians or at the time my plastic surgeon to be overwhelmed with patient calls on his break, but the fact that I felt comfortable enough to access him in time of crisis, and that we handled it, and he appreciated that we handled it so much faster talking face to face than if I had gone to the ER and reported back, was good. So just to dovetail on what Hannah was talking about there, we had wanted to talk a little bit about early planning specifically. Did you have a story as to how that could have benefited you?
I think just had I had time to get all of my ducks in a row, and had I had time to make a plan of, okay, I'm going to start with this doctor and then I'm going to move here, because unfortunately for me, my teenage years, especially with my arthritis and my Crohn's disease, were very rocky. I didn't feel like I had a good chunk of time and said, okay, I'm in a good place now, let's transition now. That would be great, but for a lot of us that have several special health care needs involved, you don't always have that, whether it's a few months or 6 months time span when things are good, to not transition in the midst of crisis, because it seems like every few weeks there's another kind of crisis. So had I been prepared to say, okay, here's what I need to do, here's how we're going to do it, here's how involved I want everybody to be, I think that in and of itself would have been incredibly helpful, as well as I think early planning starts the discussion at home. So not only between how I'm going to handle my providers, but it would have been better if my mom had sat down and said, okay, so when I was 12 years old or 13 years old maybe, okay, so when you turn 18, you're going to have to get a new doctor eventually. I probably would have freaked out at first because I loved my doctors. But just starting that discussion early of, hey, have you ever filled your own prescription? Why don't you try and give it a call today? Or have you scheduled your own doctor's appointment? Why don't you try that today? Just that whole, I just feel like the whole dynamic around my transition would have been very different if it had started earlier and I had a couple of years to do it, to say, okay, I've got a window of I'm feeling good, my health is in a good place, I'm going to go see this new specialist now. Because I'll admit, it is a little scary, I'm sure, for a physician to show up when this kid comes in and they're trying to transition and their joints are huge and they really need to be inpatient, but they've never seen me before. So how bad is this? Is this really bad? Is this kind of bad, or is this normal? I get that that's not just stressful for me, but can also be a little bit to the provider too. But just having that extra time to say, okay, we can transition smoothly so that we transition as on good of terms as possible, if that makes sense. I think that would have been beneficial in early planning.
I think some more counseling around what all is involved in managing your medical care would have been helpful for me. I did sit down with my mom and sort of pass the torch of files of information, and we did that intentionally when I was moving down to Nashville as an adult. But I think that if I could have had like, oh my gosh, my cardiologist is fantastic in Chicago, and I never really talked to him. He didn't really start the conversation, and I didn't know about, yes, you gave me a referral for an adult cardiologist who specializes in like my problems, but what questions should I be asking when I go into his office? And yes, I have your number to give them, and I know you'll be in touch because you're a fantastic doctor, and we've known each other for 10 years. But I just, a little bit more counseling on what my responsibility was in transition would have been great. Because I found out, like, in fire,
Yeah.
in crisis moments, so.
And I think for us too, one thing this goes back a little bit to the culture shock, but fits here as well, is like Sarah's also already mentioned, the access. I actually went to a doctor last Thursday, and the doctor said, I want to see you back in 2 to 3 months. And I said, great. I went to the front desk with my checkout slip that said 2 to 3 months, and they said, you can get in October 16th. And I said, but I need to be seen in 2 to 3 months. And the front desk, I also call them the gatekeepers, said, well, you can get in October 16th. So I think figuring out, okay, well, when they say that, what do you do with that? I know another thing that's frustrating for me is when I go to a doctor's visit, and I get my history is 21 years long at this point, and I don't expect the doctor to know it forwards and backwards, but I expect for him to at least maybe read the last note or two in my chart. It's really frustrating to go to a doctor's appointment and you have a history like mine, and he sits down and he says, so have you ever had surgery? And I kind of look down at my knees and I'm like, no, I've never had surgery. But if you had looked at my chart, you see there's at least 3 surgeries a year. Some years there's quite a few more than that. But went to a doctor last week who also didn't know I had arthritis. Arthritis has been like the big thing in my history, that big common denominator in everything. And at that point, they haven't read your chart when they don't even know some of the biggest parts of your medical journey. So I think a little more time to emotionally prepare for some of that too, and early planning would have been nice. Because it's stressful when your doctor says 2 to 3 months, and I don't know how many months October is, but it's more than 3. And they say that, and you're like, well, am I going to be okay if I wait till October? Is that okay? Is someone going to be checking my blood counts? Is someone monitoring everything? And I think a lot of specialists assume the other specialist is going to handle that. So it's like, oh, we assume the rheumatologist is handling that, or we assume the gastroenterologist is handling that, but no one is stepping up and saying, oh, I don't mind, I'll handle that. And in the meantime, I can't get in to see anybody. And so I know that's definitely been an adjustment that had I had some early planning into, I guess it's the culture of the adult world right now, I think that would have been nice to prepare to say, okay, well, then I'm going to designate this person to do that, or just know how to handle those situations. I think that would have been really helpful.
Yeah, like I keep a lot of my, I have a calendar, like a doctor appointment calendar, but it also has like when I need to get a refill on this and when I need to be checking in about this, and maybe I should call in about this on this calendar. And that's a way that I organize my life, and it is a part of my life. And no one really wants to see that. not people on the street. No, none of my doctors really want to see that. And I wish, and maybe again, because we're the anomaly and we have to keep track of all this gobbledygook, but I do wish that the doctor would come in a little better prepared to meet someone as prepared as we are, you know?
Exactly.
Yeah.
Exactly.